Hi, I'm Dr. Hagmeyer. I want to welcome you to my website or my YouTube channel, depending on obviously where you're watching this. Today's video is part of my Everything You Want to Know About SIBO. This is a video series that I've done. There's about 9 or 10 or 11 different videos. But this particular video itself is going to be really a two-part video series within the bigger Everything You Want to Know About SIBO video series. You know, several weeks ago, I was asked if I could put together a video on the most common reasons why SIBO treatments fail, and what my thoughts were about in terms of why they fail. And so that's what this video is going to be. If you have SIBO, you might be realizing at this point that there's much more to SIBO than what you once thought, right? The reason why SIBO is so difficult to get rid of at times is that there's a very, very long list of causes behind SIBO, including medications, as well as certain health problems. And I like to think SIBO more of a symptom really than the actual problem. Really, it's just really the tip of the iceberg. If SIBO is just the tip of the iceberg, then we need to ask ourselves, what else is going on under the water's surface? What are some of the other root causes that doctors who work with patients or those patients who have SIBO, what do they need to consider in order for treatment to be successful and have a good outcome? So today's video, I want to share with you some of the most common reasons why people who have SIBO, why they relapse, why they don't get better, and of course, what are some of the things that might make the difference between success and failure when it comes to successful treatment. So let's jump into reason number one, that your SIBO is difficult, you can't shake your SIBO, or why you've perhaps why you've relapsed. And again, of course, some of the things you can start doing and thinking about as it relates to the bigger picture of your treatment. So number one is co-infections, right? SIBO is often found in conjunction with many different kinds of infections. When you start testing for these infections, it's no surprise that we find them, right? And it's also not uncommon to have more than one co-infection at the same time. One of the most common SIBO co-infections is something called SIFO, right? Small intestinal fungal overgrowth, right? Another common co-infection would be things like H. pylori or Epstein-Barr virus or Klebsiella, cytomegalovirus, and even sometimes things like parasites like hookworms and pinworms, Giardia, C. diff. All right, these are some of the more common co-infections that we see. Sometimes a person, also has a history of Lyme disease, right? That's another kind of infection that your practitioner should be aware of as a consideration. So, if you've tried antimicrobials like rivaxamine or Xifaxan and it didn't work, the thing to understand is that you could have had other infections going on as well, and perhaps the medication or the co-infection is not sensitive to that therapeutic intervention. Not that long ago, a patient consulted my office with SIBO, and when we ran some additional testing on her, it actually turned out that she had several of these co-infections present. And once we identified what these co-infections were, we were able to very specifically then target them. And of course, that made a huge outcome improvement to the outcome, and her SIBO improved very quickly. So the moral of the story here is that if you have parasites or you have other pathogens and you don't address them, or they don't get identified or they don't get detected, trying to solve SIBO may be very slow going. All right, so keep that in mind. The name of the game here, of course, is to figure out which co-infections you need to tackle first, and of course why, right? So that's reason number one why your treatment for SIBO was unsuccessful and perhaps why you relapsed. Reason number two is we don't typically think of this, right? But if you're a person who has diabetes or prediabetes or metabolic syndrome or syndrome X, or if any of those things sound familiar and you don't know it, maybe it's time to start thinking about how blood sugar is important. Is an important problem in the gut itself, right? And this can be related to things we're going to talk about a little bit later, which is what we refer to as your cortisol levels, right? I'll talk a lot about that in a few minutes, but both acute and chronic high blood sugar can lead to terrible GI complications. 70% of diabetics have and complain about GI problems, and that's a huge number. We also know that diabetes and prediabetes, also known as insulin resistance, is a systemic disease. That means it affects many different organs in the body, many tissues, many systems of the body. And so it's not uncommon to see these blood sugar problems and fluctuations and swings in blood sugar go on to affect our GI tract and the functionality of our GI integrity. Now, the longer you have blood sugar problems, or what we call dysglycemia, the greater and more severe these GI problems will become. All right, so it becomes very important Many of the GI complications of diabetes and insulin resistance seem to be related to the nerves that supply the gut, and these now, of course, affect motility issues. Just as the nerves in the feet can be affected in peripheral neuropathy, tingling, shock-like sensations, numbness, clumsiness when you step off a stair or step off a curb. Involvement of the intestinal nerves also leads to GI neuropathy. All right, so different nerve fibers can either stimulate or inhibit intestinal motility and function. And if you have damage to these nerves affecting motility, it may be one of the reasons you have bacterial overgrowth or have problems with SIBO, where constipation is, or motility, or slowdown in motility is the common denominator there. The other thing to realize is that excess sugar in the blood or poor utilization of sugar, as in the case of prediabetes, does two things. All right. Number one, sugar feeds bacteria and it feeds yeast. Right. And so if one of those underlying co-infections is a fungal overgrowth, right, like Candida, fluctuations in sugar or eating a sugar-based diet is one reason, again, why you're not coming over that. So again, the second reason is that sugar suppresses the immune system, right? So good luck trying to overcome an infection if you're giving it this continuous steady stream and supply of food, right? So again, the important point here is that even if you don't have full-blown diabetes, you're not a full-blown diabetic, that many patients who are pre-diabetic or insulin resistant, they also have SIBO. So again, if you have SIBO, it's important to look at some of the different symptoms that are associated with these fluctuations in blood sugar. And of course, when you correct one of these, you ultimately see improvement in the other. If you're a person who gets irritable if you don't eat, right? You feel fatigued after you eat. You have increased thirst. You experience frequent fatigue. You have brain fog. Even if your diet is clean, I suggest you track your fasting blood sugar levels with a glucometer, and those can literally be picked up in any pharmacy, any CVS, any Walgreens, Walmart, right? They're all over the place. You can get one. But the big thing here that I would focus in on is that when you check these blood sugar levels, what you want to check for is your morning fasting glucose level, your morning fasting level. And what you want to see is you want to see that level less than 100, right? So any level, any number greater than 100, you are moving towards insulin resistance. Even if you're at 104, 105, and you see that over the course of, let's say, 7 or 8 days, then of course what you want to do is you want to follow up with obviously more specific testing as it relates to the potential blood sugar problem. Right? So if you had these symptoms that I just mentioned, you should follow up again with your doctor, who will run more specific tests and possibly flush out other problems related to sugar. And again, remember, sugar is a potential contributor to SIBO and SIFO. Reason number 3, why your SIBO is difficult to overcome, it really comes down to cortisol dysregulation. All right? Cortisol is released in times of stress. And that stress may be from an infection, it might be from inflammation, and it might be from what we just talked about, fluctuating levels of your blood sugar. It might be caused by a stressful work environment or a stressful home life. But the link, when we talk about the link, the link between stress and gastrointestinal diseases, I think that most people are becoming increasingly aware of the fact that the brain and the gut are intimately connected. It's obviously a well-known fact that the exposure to not only acute stress but also prolonged stress, right, will lead to many different kinds of symptoms within the gastrointestinal tract, right? Things like bloating, things like constipation, things like diarrhea, things like abdominal pain, all of those typical SIBO symptoms. Various studies show that the gut in many ways is affected by stress, right? We've seen this. In fact, there's a video that I did all about stress and the impact that stress has on the gut in many, many different parts of the gastrointestinal system, how stress influences the different parts, everything from motility to digestive enzymes to increased visceral sensitivity. In fact, here's a small little sample. If you can see this illustration here, kind of talks a little bit about the different ways that stress can impact, again, the digestive system enzymes, heightened awareness to pain, how stress can change the blood flow to the mucosal tissues, where the immune system is housed, right? That mucosal lining, we talked about that in other videos. So stress can impact that the mucosal lining and the health of mucosal tissues and how the immune system cells work in those mucosal tissues. Stress can change the kinds of bacteria in the gut, and we've seen studies that have been done at Cornell and Harvard and many other schools that have shown that people that are under acute or prolonged stress have more of a particular kind of bacteria in their gut called C. diff in relationship to different kinds of bacteria called bifidobacterium, right? So the more stress we have, the higher levels of C. diff we have and the lower levels of bifidobacterium that we see. Which again predisposes people to a whole host of different kinds of GI issues. We also know that stress causes a leaky gut, and there's a lot of videos and articles that I've run about that, and there's a lot of information on the website about leaky gut, but we also know that again, stress affects that. And this should all make sense, right? When you think about it, when you sit down to eat, you don't want to be in this sympathetic fight or flight stressed state, right? This is obviously not good for digestion. You want to be in a more rested state, a parasympathetic state. That parasympathetic state and that branch of the nerve system called the parasympathetic nerve system, this is the part of the digestive system that's most active when that parasympathetic nerve system is dominating. And that's the branch of the nerve system, again, that dominates during things like sleep and during things like digestion and especially during times where our body needs healing, right? We don't want to be in that fight or flight state. Again, not good for the gut. The gut can't do its job when it's in this fight or flight state. It needs to be in this parasympathetic state. So earlier I talked a little bit about blood sugar stability and how it's connected to the adrenal glands. And here's why. Fluctuating blood sugar levels, as in the case of diabetes and prediabetes, is a major stressor on your body. And especially at times of stress, the body begins to activate that sympathetic or that fight or flight response. So the more stress we have, the more we slow down digestion. And if you think about it, think about this. If you're inflamed or you have an infection, or again, you have those fluctuating blood sugar levels, you need to get to these, you need to get these under control, in other words, and before you can actually even, sometimes even address the SIBO. So again, earlier in past videos, we've talked about, there's all these different causes behind SIBO. And while you may have done one thing to try to treat your SIBO, there may have been other factors in your big picture that may have been a problem, right? And so if a person is continuously under stress, whether that stress is being driven by infection or inflammation or blood sugar, all of those things are going to have a negative outcome on the treatment of your SIBO or your IBS or your other GI issues, right? So the good thing to know is that there are tests that are available that can actually show how your body is responding to stress, right? We call these adrenal stress tests, right? We use them all the time in our office, and they show us the levels of cortisol levels throughout the course of the day, and if they're high and if they're low. And of course, there's lots of videos that I've done about the adrenal glands and so forth, so you can always go back and watch those as well. All right, so moving along to reason number 4, why your SIBO is difficult to shake and why perhaps it's relapsing. This one really comes down to problems with the thyroid and even sometimes thyroid replacement. I've done a video not that long ago that talks about SIBO and the connection it has to thyroid problems. In fact, if you have SIBO, I highly, highly suggest that you get a full thyroid panel done and don't settle only for a TSH and a T4 test. A study came out not that long ago in the World Journal of Gastroenterology, and it was back in February of 2017. And this study showed that levothyroxine therapy is a strong contributor to SIBO. We know that thyroid problems can be exacerbated by gut problems, but this was the first study that I came across linking the fact that medication, that thyroid replacement, levothyroxine, as an actual cause of SIBO. So if you have fatigue and depression and weight gain, and from time to time you experience anxiety, or maybe you feel cold, or maybe you experience heart palpitations, right? These could be all an undiagnosed thyroid problem, right? And if you've been diagnosed with a thyroid problem and you're taking thyroid replacement, such as levothyroxine or some sort of thyroxine medication, T4 medication, your medication may be a causing factor to your gastrointestinal symptoms and your SIBO. So again, if you want more information on that, I suggest you go back and watch that video I did. I talk about SIBO and its connection to hypothyroidism. I also did a video, by the way, that talked about the medications that cause SIBO leaky gut and dysbiosis. So again, if you're interested in knowing what those medications are and the more specifics about how that happens and the nutritional deficiencies that many of these medications cause, you can go back and you can watch those as well. So the fact of the matter is it's hard to say which came first, right? Was it the gastrointestinal system or the IBS or the SIBO problem, or was it the thyroid problem? But one thing I can tell you again comes back to the fact that when you fix one, many other areas of our body often improve. All right, so moving along to reason number 5 why you can't shake SIBO. This comes to diet, right? This is a huge area for discussion. So I'm only going to hit the 3 or 4 major areas that I often see problems in. And so number 1 is that you're eating a low FODMAP diet at the right time. You're not eating a low FODMAP diet at the right time during your SIBO protocol. Number 2 is your FODMAP diet needs to be tweaked a little bit based on your individual food sensitivities. And this is where, again, you need to be tested. This is not something you can guess about. And you may be doing a great job following a low FODMAP diet, but you also may be reacting to some of those foods that show up on a low FODMAP diet. So your immune system could be reacting to those foods. Reason number 3 is you lack consistency with the low FODMAP diet, or you have food sensitivities above and beyond the low FODMAP diet. Here's what I would say. Relying on a low FODMAP diet to correct the problem is only, again, one piece of the puzzle. I say this over and over and over again because I think all too often I have patients who they have been on a low FODMAP diet for months, 6 months, 8 months, 10 months, 12 months. And their mindset is that this low FODMAP diet is going to be something that fixes their bacterial overgrowth. And it's not. Really, the only thing that the low FODMAP diet is taking away one of the igniters, okay, one of the fuel sources for the bacteria. Because remember, these bacteria are feeding on these foods, and in the process of fermenting those foods in the small intestines, they're basically releasing either hydrogen or methane or a combination of hydrogen and methane into the intestines. Right? So in other words, you can't get rid of SIBO with diet alone. Again, it's only one piece of the puzzle. All right. What else do we want to talk about? We want to talk about food sensitivities that are very similar to gluten. That's another one. Many times people go on a low FODMAP diet and they eliminate gluten, but there are some other foods that may have kind of snuck into their diet. Maybe there's gluten sensitivity, which what we call cross-reactive foods that are very similar in structure to gluten. And again, the overlap between gluten sensitivity and the symptoms of gluten sensitivity may be the same symptoms that you're experiencing as someone with SIBO. Again, diet is only tip of the iceberg. Remember, a person who has SIBO could have a histamine intolerance. Again, I just mentioned earlier, they could have gluten sensitivity, they could have gluten cross-reactivity, but they also could be reacting to things like lectins, which again are one of those things that sometimes are permissible on a low FODMAP diet. Fermented foods, for example. Many people have heard about healing the gut by using fermented foods. But if you're a person with SIBO, those fermented foods may be the very cause of why your gut's not healing, because you, in your particular case, may be reacting to histamines. There's also a video that I did, by the way, that talks about the different kinds of probiotics. Some probiotics, by the way, are capable of increasing histamine in our body, and there are some probiotics that have a histamine-lowering effect on our body. So that might be something you want to go back and look at a later date and time as well. Again, sometimes this is always hard, but you take the person that's on a low FODMAP diet and they're following it to the T. I mean, they're your perfect patient. Everything they're doing is to the T. They're never venturing into those red areas or even that yellow area. But again, they're reacting to these low FODMAPs from a food sensitivity standpoint or a food allergy standpoint. So again, sometimes testing in those areas become very, very important as well. What else do we want to talk about? All right, so the other thing I want to say here is that, when we talk about these food sensitivities on a low FODMAP diet, this is something that I wish more and more people understood, and especially a lot of doctors out there that are actually treating patients, is that, you could be reacting to foods on a low FODMAP diet. So, I don't want to go over that point too quickly. If you have SIBO and if you have been following a low FODMAP diet, I believe it's very, very important to actually get tested for these food sensitivities, okay? Don't be discouraged. Again, just understand that when it comes to food, there are many possible scenarios that you or your doctor could be missing. And again, this is where, again, you should work with a doctor who understands this, but you should also work with a functional nutritionist who can help guide you in these areas and these finer points. One more thing I want to say, I want you to be aware of when it comes to SIBO and diet is that you could be eating a low FODMAP diet at the wrong time. And what I mean by that, eating it at the wrong time is this. If you're eating a low FODMAP diet when you're trying to kill the bacteria or lessen the load of those bacteria in the small intestine, it might be counterproductive eating that low FODMAP diet. And sometimes what we want to do is we want to load up on these FODMAPs, believe it or not. And again, the rationale behind this is that when you start eating these foods, you encourage the growth of these bacteria. And so encouraging the growth then allows you to basically hit these bacteria and have more effectiveness on eradicating them and dropping their populations and the counts of those bacteria in the small intestines, right? Eating foods that are high in FODMAPs, like I said, is like throwing a party for these bacteria, and sometimes that's what you want to do. You want to coax them out. You want to invite them to this lunch buffet, and then bam, you want to hit them with whatever it is that you're using, whether it's antimicrobials or antifungals or even antibiotics, whatever option you and your doctor, whoever you're working with, is the route that they want to go through. So again, these are just some of the finer points that I think are some strategies I hope that you can implement. And again, I think these are part of the reasons why we have the success that we do in helping patients with SIBO. So that's going to wrap up this part of the video series. Just a couple last thoughts and last reminders. Remember, number one is that SIBO is not an infection like strep throat. If you think you can just throw an antibiotic at it, or just take some antimicrobials, or change your diet so that you're eating low FODMAPs, and then of course take a probiotic and HCl, well, that seems like a lot. That doesn't even skim the surface of really what's going on, right? And so if that's all you've been doing, chances are you're going to be in, unfortunately, for a major disappointment and battling this much longer, all right? Number two, we talked about cortisol levels. Again, these are very, very important, but fluctuating blood sugar levels and your cortisol levels also take a toll on gastrointestinal tract. So again, think about, the stressful things in your life, whether they be home-based or work-based, whatever those might be, and start tackling them from a lifestyle standpoint. Number three is that SIBO, of course, without a doubt, it's a very challenging problem, right, for many reasons. And it's important that whoever you work with, that they understand this big picture and that they customize and tailor not only testing, but that treatment plan to you. And that's really the key. Your treatment plan, at least for me, the treatment plan that I come up with for a patient is based on the testing that we do. And so in order to have a good treatment plan, we need to have good testing. We need to have good data. And I think that becomes an important distinction. I don't ever recommend people going at this blind and not going and having some tests done to kind of clear up some of the areas that are murky, right? Number four, the medical journal sums it up. The one that you see right here in terms of the treatment philosophy of SIBO. I like it, and so I want you to read this. It says here that therapy for SIBO must be complex. It must address all the causes of the symptoms and the complications, and it must be fully individualized, right? Prognosis is usually serious, and it's determined mostly by the underlying diseases that led to SIBO. And I couldn't agree more. I see too many non-physicians treating patients who have SIBO who don't have the health background and they don't have the experience in these things. Sure, they can run a test perhaps. Maybe they can even make some recommendations in terms of taking this antimicrobial or this antifungal. But unfortunately, there are many other scenarios that are playing out. There's a lot of other health conditions that they just don't have the experience in. So again, this is something that I think is very, very important. It's scary to me that when I go on a Facebook page that's, for doctors, and some of these doctors and even, other people that are treating patients with SIBO, they're asking what should be done for this patient based on this test. And unfortunately for the patient, that patient fails to receive the proper treatment, the proper testing, the proper management. And of course, in the long run, this leads to more difficult cases and more resistant cases of SIBO. And I'm certainly seeing more and more of that with the patients that are coming to me after failed treatment. So I hope that's not happening to you. And I hope that with today's video that you learned a few things. I hope you found value in today's video. If you did, make sure you share it with some of the people that you know that are struggling with SIBO. Make sure that you leave a comment below, and just understand that there's a second part to this video series. We're going to review 6 more reasons why people who have SIBO can't shake SIBO, and what they can do to improve your outcome. And so I hope you're enjoying this video series. Take care.